Psychotherapy is a general term used to describe any kind of therapy that treats the mind and not the body, which includes many different perspectives: psychoanalytic, humanistic, behavioral, and cognitive. Somatic treatments, on the other hand, use drugs, electronic shocks, and brain surgery to treat mental disorders. Psychotherapy and somatic therapy both strive to treat abnormal behavior. If a behavior is harmful to the individual, if a behavior is disturbing to others, if a behavior is unusual, if a behavior is irrational, then it is labeled as abnormal. It is important to note that people's beliefs about effective treatment are grounded in their ideas about the cause of the problem. Different causes, different therapies. Each perspective has its own theory for the cause of disorders, and in consequence, psychologists of each perspective focus their treatment on solving what they believe is the cause of the problem. The psychoanalytic therapy was developed by Sigmund Freud. Psychoanalytic theorists believe that the causes of disorders are unconscious conflicts from childhood. Ipso facto, psychoanalysts focus on identifying the unconscious cause of the problem. Dream analysis, free association, transference, resistance. These are what psychologists use to tap into the unconscious to resolve the problem. In dream analysis, the patients are asked to describe their dreams, while the psychologists focus on interpreting the latent content of the dream. Free association is when patients are asked to say whatever comes to mind without thinking. The psychoanalytic perspective has been heavily criticized for relying too much on the interpretations of the psychologist. Humanistic therapies focus on helping people understand themselves, accept themselves, and strive to self-actualize. Based on the belief in free will is humanistic therapy. Carl Rogers is most closely associated with humanistic therapy because of his client-centered therapy. In this form of therapy, clients are provided with an unconditional positive regard and a non-directive approach. Clients feel accepted regardless, and their psychologists actively listen to them without directly telling them what to do. Instead, the humanistic therapists guide their patients to arrive at an answer themselves. The psychoanalytic and humanistic perspectives are referred to as insight therapies because they highlight the importance of patients gaining an understanding of their problems. Behaviorists believe that all behavior is learned. Behavioral therapies utilize classical conditioning, or counter-conditioning, and operant conditioning. Systematic desensitization involves teaching the client to replace the feelings of anxiety with relaxation and build an anxiety hierarchy, and then reach the top of the hierarchy while staying relaxed. This method is especially effective in treating phobias. Aversive conditioning involves pairing a bad habit with an unpleasant stimulus, such as pairing smoking cigarettes with nausea or an electric shock. This decreases the likelihood of the behavior happening again. Token economies are used widely in mental institutions so that desired behaviors become identified with rewards. Tokens, such as tickets, can be earned and later traded for something valuable. Cognitive therapists locate the cause of psychological problems in the way people think. Cognitive therapies are combative and confrontational because therapists challenge the irrational thinking patterns of their clients in order to change these negative thinking patterns into more healthy thinking patterns. Anxiety and mood disorders are often treated with cognitive therapies because people tend to have negative ideas about themselves, their world, and their future. Cognitive therapists help make these ideas more positive. Group therapies are a manifestation of the humanistic therapy. Group therapies can be less expensive and show people that their problems are not unique. Some self-help groups, such as Alcoholics Anonymous, are a form of group therapy that do not even involve a psychologist. Since a client's problems do not occur in a vacuum, family therapies actually prove to be helpful. Meeting with the whole family and altering the behavior of the whole family rather than just one member is what defines family therapy. There is a distinction to be made about psychiatrists and clinical psychologists. Psychiatrists are medical doctors and are therefore the only therapists permitted to prescribe medication. Clinical psychologists earn PhDs that require 4 or more years of study but cannot prescribe any medication, so they utilize psychotherapies. A final note, it is important to understand that therapists do not exclusively use one type of therapy. Many therapists are eclectic and use cognitive, behavioral, psychoanalytic, or humanistic therapies based on what they think will work for their client.